My name is Alan Ringard. I graduated from University of Pacific in 1984. I've been in practice in Napa, California since 1987. And I started out in a 3-operatory, 1,000 square foot space. Have since moved into a 3,250 square foot space. We have 7 operatories. I started out with no hygienist. The doctor had done the hygiene by himself. So I had to transition the patients from the doctor doing that to a hygienist. So I started off with 1.
We just knew there was a need. We knew that our hygiene production was really low. It was basically just paying for the hygienists. And so many people, I've been in dentistry for a long time, and so many people always talk about the hygiene department being the loss leader, you know. And I knew it didn't have to be like that, that hygiene could definitely produce and be part of a productive net income for the practice. So that was where we were wanting to go. We just didn't know how to get there.
I don't believe that the hygienist had the skills to communicate to the patient the disease process, the treatment process, and also that there was a financial commitment. I think it's fair to say that we tried on our own to do this. We also tried going to some courses. I think we probably went to 2 or 3 different courses offered by trainers and so on and so forth. The problem with that was it was up to us, once we had gone to that place and heard that information, to take this stack of paper and come back and implement it. And that was the challenge.
How we do it in our office is we really just present their needs, present their treatment. We treat their disease, basically, and explain to them what their needs are. We spend a lot of time on oral hygiene instruction and explaining to them what the therapy will involve, why they need it, and then really their insurance benefits, their treatment plan. That is all handled with our scheduling coordinator, our office manager.
And so that's what the system did, is gave us those tools to get where we needed to go.
You are really changing a lot of things. That's requiring a lot more of the team. Treatment planning, that is a lot more involved. Instead of just doing the standard 4 quadrants of scaling root planning, you're presenting an entire treatment periodontal need package to the patient.
Some of the challenges was everybody getting comfortable enough to change from just standardizing that a patient needed 4 quads of root planing, which we had been calling it and doing that for years, to individualized therapy for the patients depending on their need. That was just a learning curve. They definitely helped us with the verbal skills on how to explain that to our patients and to teach us why it's so important to treat patients individually, not just lump them into their perio patient that needs 4 quads of root planing. And the hygienists have the power and the ability to do whatever they need to do for their own patients. And that alone increases your practice productivity, because if the team members feel like they're empowered to do what they need to do to give their patients the best care, you can't lose. And that's been a huge thing. And what I think that definitely takes the right person to be able to do that, but you can have the right person, because we did. We have the exact same team members here, only many more added to it, that we did for the past 12 years. No one is left that was here 12 years ago when our core group started this practice. And they now can do so much more because they had a system. We knew what we wanted to do. We knew where we wanted to go. We just didn't know how to get there.
We actually brought real live patients in, did the process with live patients, and then were able to do kind of a critique and just really do a post-mortem on each presentation. And it couldn't have been better. The amazing thing was we had just this great case acceptance at the time, and each time that a live patient would come in, and what more could you ask for in terms of reinforcement? Like, oh gosh, this works, So the learning process is, I would just say it's participatory learning, and it's a learning by doing, and I think it's the surgeons, watch one, do one, teach one, because we actually had our other hygienists helping our other hygienists within the critique. They say, well, what I would say at that point would be this, and of course that means that they're working through the process themselves.
It has to be a seamless transition. It starts with the hygienist, the relationships with the hygienist and the patient, but it has to be seamless for the entire office. The assistant has to know how to do the full mouth probe, what to say, when to say it. The doctor during the exam, that has to be seamless. They have to come in and validate what the hygienist has found, and it's a different exam. That was a little bit of an adjustment for our office. We did our doctor hygiene exams a little bit differently. But once you get into a routine of that, it becomes really natural and very easy. And then the front. And then we take our patients to the front. And so it has to be a seamless transition all the way around, actually, not just between the treatment coordinating and the hygiene department.
We wouldn't do it any other way now. It's so ingrained, and hygienists who come out of school and come to this office for a working interview are just blown away. Like, this is just like I learned in school, and which beats the 45-minute pro fee and the 10-12 patient schedule that they're doing down the street, and no report, no explanation, no just zim zim zim, and the doctor's cracking the whip saying, I'm paying you X number of dollars a day. You do these 12 patients and hit the road. I mean, it's just, there's just no relationship with the patients, no relationship doctor, hygienist. Hygienist doesn't have time to encourage the patient to pursue other dental treatment, which is probably the greatest avenue of generating treatment in any practice.
Presenting the total package to the patient helped us, and it also let the patients know, presenting it as one fee, they weren't so worried about their 80% because the hygienist had already spoken to them about their disease is different than the next patient or than the patient before them, and that they need so many hours of therapy, and that's what their fee is based on. And once you present it as a package and they understand that their insurance company just has a pigeonholed fee, they don't care that you may need more hours than the patient before them. And once you're able to explain that to your patients, all they want to do is take care of the disease. The fee becomes secondary to the treatment and how we go ahead and schedule it and get it completed.
My hygienists see 8 patients a day. That's it. They are spending time discussing the disease process, discussing the treatment. If the patient's all up to snuff, they're taking the extra time to discuss treatment. They're discussing aesthetic options. They have the time because they have the rapport. Why? Because they've seen the patient 3 or 4 times in the first 2 or 3 months that they're in the practice. And it's not, you come in, you get your teeth clean, I'll see you in 6 months. The doctor just has a few things he's keeping an eye on. Ciao. It's a totally different mindset. Now we have such a strong program that any hygienist comes in, she just is, I guess, indoctrinated by the majority and is supported by the majority and learns. Any hygienist that comes in, first of all, goes through some training for the specific verbiage and paperwork that we do use, but it's totally supported by the other hygiene people and then the team, the assistants. I mean, everybody's on board with how we do this. So somebody can come in kind of, feel like they're overwhelmed at first. Once they get on board with the program, they're very, very happy to be doing it the way that we do it. And when they see the patients, the actual success of the treatment, the intrinsic reward, it beats the paycheck every day.
It feels great. I sleep very well at night because at the end of the day I feel like I have really given my patients exactly what they need. I've been able to provide them with the treatment they should have instead of being dictated by a limitation, basically, which is usually an insurance. So it's a very rewarding and satisfying feeling.
My hygienists are probably 100% more profitable now than we were prior to doing this program. So no, they're absolutely more profitable. We have 10 days of hygiene in the practice, which is a significant change from 0. So yeah, we've come a long way.